So creative health, it's a new term that helps us describe creative activity, so arts, things like singing, dancing, that supports health and well-being. There's a huge amount of evidence now that across the life course, different ways of engaging in the arts and also being creative can impact on health and well-being. So the first thing to remember is that if we haven't got a reason to live, we're not going to look after ourselves. And arts and creativity are a really good way to find reasons to live, to have hope, to have ambition, to build your self-confidence. So in that sense, there's no health without mental health, and these activities are really good for mental health. But we also know that they have actual impact on physical health as well.
Massively improving society.
Here at Pavilion Dance South West, we work with a particular model of teaching which is called Parkinson's dance science.
Moving to music and it gets your limbs moving.
This actually gives him the opportunity to exercise muscles, try and be coordinated, that he wouldn't otherwise have the opportunity to do so.
It's really important that we begin to understand as a country, as a county, as communities, neighbourhoods, villages, the importance of creativity in everyday life, and the value that it brings is not just for the person, but it's also for our society. In 2014, there was an all-party parliamentary group set up on arts, health and wellbeing. That group has enabled the National Centre for Creative Health to be set up. So we're looking now at how we can support more creative health activities, both here in Dorset, but also at national level.
We have a sort of 10-year practice of a creative health programme at the Bournemouth Symphony Orchestra, and that is rooted in partnerships. So we are an arts organisation, and in order to do that work effectively, we need to partner with health and social care partners.
More and more people are realising the benefits of creative health. It's part of NHS England's 10-year plan to focus on prevention, and creative health very much comes into that category.
It's so collaborative with the stroke therapy team. It's about, you know, if you can encourage somebody to shake an egg, then they're on their way to brushing their hair, but they're doing that playing some music that they love.
So we'll be contributing to maybe more specific health outcomes with stroke patients, working on sort of developing strength in particular limbs or helping develop speech and language through singing. All the research shows if you're happier, you get better quicker.
So we know in places where they've been collecting data for a number of years that engaging in creative health reduces hospital admissions and supports things like planned care. It's also exceptionally good value for money.
There is evidence that for every £1 you invest in creative health with dementia patients, you will receive over £6 return on your investment.
Because creative health is so broad, I've mapped different levels of creative health intervention onto a pyramid. So at the bottom of the pyramid, the biggest group of people is a universal level. That's people who usually don't have a health need, and it's where prevention happens. And the activities that people get involved in at that level are things like just going to the theatre, attending a gallery or a museum, arts education in schools, knit and natter at your local library. It's anything really that you don't need much support to attend and you can just engage in. As you move up through the pyramid, that's where we might meet people who've already got an existing health condition or are living with a long-term condition, or perhaps at risk of developing a secondary condition. And in the middle, we've got a supported level. So that is about setting up groups and encouraging people to attend, and those groups are supported. So they are accessible. They might include things like understanding how to use sign language if you're a BSL user. They might include being able to adapt for people's mental health problems. If it's for elders in the population, it might be thinking about the impact of what time of day it happens, what refreshments are provided. And at the top of the pyramid, we've got specific. So that's really thinking about how creativity works well with science and medicine quite often to offer a specific intervention. So at this level, might be thinking about singing for lung health or Parkinson's dance, which are both ways that use science and creativity together to support a health outcome and to help maintain somebody's health. When we are thinking about creative health projects specifically, so in those supported and those targeted settings, then the Creative Health Quality Framework helps us understand what quality looks like, and that's defined on 8 principles: person-centred, equitable, safe, creative, collaborative, realistic, reflective and sustainable. It's easy to use, and actually if you are doing creative health practice really well, you are following those 8 principles. So it's nothing new. If projects are quality, they adhere to those principles, it's a good creative health project.
So I trained initially in fine art and then went into performance art and performance drawing, and then I became an occupational therapist through one way or another, and then I've come back to art, and I feel like it's really informed by occupational therapy theory that I learnt in terms of using the whole body to make a drawing, which is exactly what you learn when you go to Art Foundation. You don't draw from your wrist, you draw from your shoulder. And so the activities that I choose, like drawing on a wall, it just builds your muscles. Spinning like vestibular input is really calming. If they didn't get the opportunity to play in this way, their sort of horizons for what's possible in life are so much more limited.
Creative health is therapeutic, but it is different to arts therapies. Arts therapies are normally quite specific, often one-to-one, and you're focused on a problem that you're working through with a therapist towards a health outcome. In creative health, the focus is on the art form. It's often done in group settings, so with other people, and it's less about what you can't do or what you're struggling with, and more what you can do and what you bring as an artist first.
Today I'm working with the Dorset Deaf Activities group here in Dorset Museum. They're all British Sign Language users.
We don't feel included in hearing social. It's not a beef, it's just statement of fact.
Once they're in that room together, they have a shared language, a shared culture, shared experience. They're in a really safe space.
Just try art. You know, you can polish up your own skills, you can really increase your confidence. It's so good for your mental health. You know, the confidence will grow. You've just got to try, and everyone will help you. And everyone feels like that at the start, but you know, it's really, really good for mental health.
The fact that everything that happens in creative health is person-centred places that person at the centre of their creative journey. So everything that they do is the right answer. You don't need a level of skill, you just need to be prepared to come into the space and give it a go.
There's no right or wrong thing that you do.
Dance settings allow people to really come together and connect with each other.
When I play, I feel like I can touch people that are non-verbal.
It's fun and calming.
I look forward to it, and I look forward to the future as well with it. It keeps myself positive. I link to positivity, coming here.
It's really important that we start to spread the message and increase the activities that are happening, and there's some ways that we want to invite you to do that. So the first thing is to notice how creativity plays a part in your life and how it supports your health and well-being. And then share the creative health message, talk to people about how creativity is important and how it can benefit them. And then finally connect into the national conversations, the local conversations, and support us to really help spread the message and ensure that being creative can be an option for everybody in our society.